You can see the abnormality of teeth.
Yeah.
All right. What's happened here? What do you think of this happened?
So those are backups. They are just some extra. I'm not gonna say they extra teeth, but
No.
you saying the roots?
This here the child didn't have the premolar, second premolar. So this is the baby molar stay there. Can you see this?
Uh,
This is a
yeah.
baby molar. This is adult molar. So when the child doesn't have the premolar, look at this one. There's a premolar here. It
Mhm.
pushed the first molar away. It make the root result and get it away. So if they don't have it,
You'll
the
stay.
baby molar stays there. Baby stays there and forever. And sometimes they stays until 20, 30, and sometimes because they are babies' teeth, they get decay and they get submergence, they will be lower than the adult, and there's food stuck in it, and it's difficult to treat it. Like you cannot do root canal on it if it need to be. So either they extract it, and so that's congenitally missing. Some people they don't have the number of adult teeth.
So
That's
that's when they put the extra spacer there too to make.
sometimes if they extract it early, they have to put the spacer or stuff, but sometimes they don't have premolar. Premolar never erupt. The second premolar is not there. So the baby molar stays.
Okay.
That's a
Yeah.
case. What's this case? I think I have the writing here. Lateral incisor is missing. Sometimes people they don't have lateral incisor. Central canine.
Right.
Yeah. So these people are they have spacing front teeth. So the treatment you have to push the canine away to create a space for the laterals, and you can create either you put uh, partial denture, removable laterals, partial denture, or you can do implant here, or you can make a bridge from the canine central, but that is more aggressive for lateral. So mesodens. Mesodens is common. I've seen in Latino people, Latino children. They have mesodens. Mesodens, it's extra tooth, another tooth, extra tooth, but happens in the midline, what they call mesodens. So it will be like a conical shape, very small one, and it always can cause the diastema, space between teeth, and sometimes it's impacted, it's
Mhm.
still inside the bone. It's not so.
I have seen these before after I done taking
Yes,
it.
it will be like that, and some people like it. Some people it's
And
ugly.
some
So
people don't even know that they have them because no one
yeah, it's acceptable. Some people, but sometimes if you extract that thing, you get a space. You have very big space between the front teeth. That's the thing. That's the mesodens. Sometimes people have extra central incisor. We have usually two central incisors. Some people have three central incisors and cause crowding. Central incisor is a big tooth. So here, the decision for the dentist, what are we going to do? We have to extract the one which is, if we extract, it will be easier to do braces on. I think we can extract this one because these are aligned with the same line. That's so people have extra teeth like this. And sometimes people have central canine and lateral. It's very rare, but I've seen it when they do surgery, like people are cleft lip and palate, when they do surgery when on the child and they messed up the teeth buds. The teeth is still buds and they messed it up and you will see the sequence is not. But sometimes it happens. You can see central, it should be lateral here, but the canine took its place. Like another thing. This is the canine and lateral incisor. They took exchange places.
That's my first time ever seeing it.
Yeah, it's you can sometimes you never know. Like this one, they have five central incisor, three central incisor, but no one will know because they look the same. Yes. And one day I'll look at the panoramic and I see extra molar, a third molar. There's a fourth molars. They call it retromolars. And no one knows because it looks the same. This one looks, if you're not in the dental, you will see like they're normal teeth, but there's extra central incisor. This is lateral, central, 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 lateral. So these are extra teeth. That's So the treatment, so for this case, the treatment is just leave them. If they fit, there's a space for them and there's no problem, just leave them there. Because they adapt. The jaw will adapt to that, especially if they are congenitally, like they grow when they are. But if they make crowding and problems, that's good. So extra tooth they call supernumerary, like extra number, supernumerary. So third molar, third molars always have troubles because it's extra tooth. Always, because it's the last tooth to erupt, has, so always there's extra third molar. We call it fourth molar, and sometimes the extra tooth can cause the tooth to be impacted. And I've seen a lot of the extra premolar, and extra premolar can cause a problem because in the lower premolar we have 3 premolars, but they sit like this, and there's food will stack here, and it get decay. And guess what? Which one is get decay? The buccal space is always thicker than the lingual space, so it will get decay. The teeth, they are in line. That's the worst thing. So you have to, if you find it early, you have to extract it early, because that can cause decay of the teeth in ill line. That's the thing. So that's extra premolars and extra molars here. And sometimes teeth looks like a cone shape, pig shape. You've seen that.
Mm-hmm.
That's the treatment is by a crown. You have to do a crown on it. The most common is central incisor, lateral incisor. Lateral incisor, and sometimes the premolars are like pig shape. Gemination when one tooth become 2 teeth, or 2 teeth. One tooth become 2 teeth. Like one tooth, the bud will change to 2 teeth. Like here, lateral incisor changed to 2 teeth. And the other thing called fusion. Fusion, there are 2 teeth, they mix together. When they are bud, most likely sometimes they do surgery, or the medication can cause the bud will merge and make 2 teeth to fuse together. But if it's acceptable, like, it's acceptable. Oh, there's a disease, nowadays it's very rare, but at that time, syphilis. Syphilis is a bacteria. Is a spirochete. Spirochete, it's moved like that. Spirochete. Some people call it spirochete. Syphilis has affinity to pass through the placenta barrier. So if the mother has the syphilis will go to the growing fetus and damage the teeth, damage the eye, damage the brain, or whatever. But the teeth will very obvious. So the teeth will be like the central incisor will be like screwdrivers. The molar will be mulberry molars, like has a blueberry shape. And so this is the syphilis. Treatment is you can do, this is called congenital syphilis. The treatment is a crown. You do the crown on it. Hypercementosis. This is like a nightmare for extraction of the teeth. I've seen it in African American women more. That's why the extraction is very difficult, because the cementum around the root would be very thick, and the tooth is so fused to that. So extraction is very difficult. You have to remove the bone around it, and it can cause a fracture, hypercementosis. Sometimes the teeth are rotated. This is the second premolar. You can see this is the buccal side, this is the lingual side. And I've seen that happen when they, like, if you extract the baby tooth and you try to clean the socket, you might damage the bud of the baby, of the adult molar. They're still there. So whenever you do surgery in the child, when you extract the baby tooth, don't do scrapping or do that, because that can cause all these problems. Ectodermal dysplasia. Remember, it's common now. I've seen in white people, ectodermal dysplasia. Ectodermal dysplasia, the body, remember when the fertilize over, let me admit. Yeah, it's when the growing embryo, it will change to 3 layers, 2 layers first, ectoderm and endoderm, and there's a third layer become between them. They cause mesoderm. Anyway, so the ectoderm usually it's gonna form the skin, the enamel, and the endoderm will cause the pulp and the dentin. So they are different. So whenever they have ectodermal dysplasia, we have abnormal enamels, ectodermal dysplasia, and they have less teeth, and they have skin problem and hair problem and vision. Even the eye will be different. Sometimes the dentin will be something wrong with the dentin. Dentinogenesis imperfecta. Sometimes it's dentinogenesis, sometimes osteogenesis, and the bone also imperfecta. Sometimes the dentin is abnormal. The root are very small, and because the dentin is abnormal, the enamel will be chipped away. So immediately you have exposed dentin and become sensitive. So you have to do crowns on these. Sometimes you end up to do complete denture, and the teeth will be brittle because the enamel is easily to be chipped away because we have very abnormally dentin.
Sometimes this is also called by the medication that the
yeah. Sometimes medication, the mother will take some medication will affect the children. Before there's a tetracycline, remember? But nowadays, no one uses tetracycline. Tetracycline antibiotic can cause a staining. Taurodontism. Tauro mean like a male cow from taur in Latin. So it's because of horn. So that's a ox.
They call it Count Dracula in hygiene school because that's how I remember it when I seen it.
Okay, the Dracula. Yeah, this is one of the condition, but sometimes cause no problem. But when you do need to do root canal, it's a little bit difficult when you do root canal. Dilaceration. Dilaceration, the root will be like rotated like that. I've seen it in central incisor. What happened? Imagine a child 4 years old. They have the baby tooth here and the adult tooth on top of it. Adult tooth like growing, the root is not complete yet. So if the child fall on the baby tooth will hit the adult tooth inside the bone, and the adult tooth it will change the position. So the root gonna be dilacerated. Dilacerated mean abnormal shape of the root. So something happened to this adult tooth. Internal and external resorption. Resorption means something eating that tissue. Like bone resorption is normal. There's bone formation, bone resorption. There's always bone remodeling. But the dentin, once it happened, the dentin should not be resolved. They said many theories. One of the theories, there's a big cell called osteoclast. Osteoclast, its function to remodel the bone. Let me see if we have a new message. Yes, yeah, thank you. By the way, Dana, we have, did you see the Google Doc? We have a Google document. Let me put it for you. I'll send it to you. Okay, so if you can put Marshall. Hi, Marshall. How are you?
Morning, doctor. I'm good. How are you?
Good. How was the
Chris Brown concert?
Yes.
It was fun.
Okay.
I got pretty videos to show everybody.
All right, I can send this out.
All right.
Yeah, here if you can find the Google document, just put the stuff that the course you needed, and I put the fall course, and we're gonna suggest the spring courses. So I'm gonna have an idea about for the courses if you can. All right. These I just want to show you this fast. These are, we're talking about abnormality of teeth. Sometimes when we don't have adult teeth, the baby teeth is still there. So in this case, we don't have a premolar, the baby molar is still there. And like this patient he's in the 20s because these second molars are erupting to is around 16, 14. So there's no adult premolar, the baby molar is still there. When they have missing lateral incisor, is a common missing lateral incisor. We have spacing, and you have the treatment is either implant, partial denture, removal partial denture, or we can bridge. And we have extra teeth. This is the mesodents. Extra teeth usually happen in between the central incisor. This is extra tooth. Sometimes we have extra central incisor, and sometimes the position of the teeth can be the position of the canine take the space of the lateral. Sometimes the lateral take the space of central. It happens. It's very rare, but sometimes it happens. Sometimes we have extra tooth. We have extra central incisor here. We have 5 lower incisors here. And sometimes we have extra third molar. We have called fourth molars. And we have extra premolars. These are, I will send you the lecture when we finish. We have pick-shaped teeth. We have gemination. Gemination means one tooth become 2 teeth. Fusion is 2 teeth meet together to make 1 tooth. There's a disease called congenital syphilis, can affect the development of teeth. The teeth, like central incisor, will be like screwdriver. The molar will be like blueberry teeth. This is hypercementosis, rotation of teeth, ectodermal dysplasia. There's a disease can affect the enamel. Dentinogenesis imperfecta. Sometimes even osteogenesis imperfecta is a disease also affect the dentin. We have abnormal dentin. The teeth, the enamel would be chipped away. Toroidism is abnormal shape of the teeth. The laceration when the root is abnormal. Internal resorption, something eating the dentin from something inside, and most likely I told about there is osteoclast, the cell that remodel bone, sometimes activated by trauma, by infection, by unknown something. It happened. It will eat the dentin from inside. So the tooth will be like a shell of enamel because the dentin will be eating down, and it will crack immediately. So the treatment, if you find it early, do root canal. So you remove all the pulp tissue, all the tissues, and you do root canal. But when if it eats all the root, treatment is extraction and do implant, or we do a bridge. That's internal resorption. External resorption is something from outside. Most likely here, like this is a cyst tumor or cyst abnormal pathology. Too much pressure on the tooth, it makes the tissue change to something will eat the root, and the tooth will be loose. This is a tumor. And sometimes the patient you can see like simple trauma, they have fracture because there's something eating the bone and eating the teeth too. That's called external resorption. This is amelogenesis imperfecta, abnormal enamel. Usually it looks like that. The treatment, either, I think you can treat it by crowns or veneers. This is abnormal enamel, is an amelogenesis imperfecta. This is tetracycline staining we were talking about. Tetracycline is antibiotic, but it passed through the placenta, go to the developing fetus, and goes inside the dentin and cause discoloration of teeth. Abrasion usually by excessive force. Abrasion, people who brush their teeth so hard, that's abrasion. You've seen these cases, Chandra? Yeah, these people, obsessive, some people obsessive. And you can see in one side, because they're right-handed, they do this side more than the left-handed, and the left side because they use this way. And attrition, this comes with age. And it can be worse when people grind their teeth. Paroxysm, because they grind their teeth, and most of the people, they grind their teeth and they don't know, unless their wife or husband, they tell them, you grind your teeth, I can't sleep. Yeah. And treatment, you can do night guard, take compression and make a night guard. Have you had anybody had night guard? There's you can do the lower night guard. You can do if some people have gag reflex, you can do the night guard. So on the lower, you can do the lower. It just cover the occlusal surface of the teeth, but you want it big enough not to, for the patient not to swallow it, and small enough don't cause gag reflex. So attrition. Fluorosis. The fluoride has a certain when you drink water, most of the water, it's 1 part per million. Like every million cup of water you drink, there's a 1 cup of fluoride. That's 1 part per million is the acceptable. It's good for teeth. But if it's, I think it's 10 or more part per million, can cause a staining of teeth, fluorosis. But the teeth will be yellowish, but it's more resistant to decay. This is how developmental defect of teeth. This can be hereditary, systemic, traumatic, a local factor, drugs, and can be idiopathic. This is just talking about. I was talking about it. These developmental. I'll show you the pictures. That's postnatal. Neonatal, when the baby born with it. Postnatal happen after the enamel defect. Enamel. When you see them lying like that, what do you think? This has happened at certain age, because that age, all these teeth, they are growing at the same time, and the patient has fever. Like the child at 2 years old has fever, and at the 2 years old, all these teeth are growing, and there's something happened to that, or the child has infection or something. That's what happened. That's it. All these things. Should be symmetrical. Localized enamel hypoplasia, Turner's teeth. I never seen that. This is just in the book. Turner teeth. I've seen a lot of, this is fluorosis. I talk about the dental fluorosis. This is a picture of fluorosis. Treatment, composite treatment. I do veneer, or you can do a crown on it. You can do congenital syphilis. We were talking about the congenital syphilis. This is Hutchinson teeth, abnormal screwdriver shaped teeth, or mulberry molars. Attrition. Why the lecture is repeat itself? Okay. Tooth brushing injury. This is paroxysm. People grind their teeth. This is another toothbrush. Sometimes they will grind the teeth down on cervical side. Even they will cut the gum to V-shaped cervical area. Sensitive. Another case of toothbrushing, abrasion, habitual. Erosion. Erosion is caused by acid. some people, they drink a lot of acid. People who like acid, they will have erosion, and the erosion happen in the inner side, the lingual side of the teeth. And some people, you know, what's a bulimia? People throw up a lot. And nowadays, I've seen it people with gastric bypass. People, when they do surgery, they have a lot of gastric bypass. The acid will go, and the acid is very constricted, will eat the inner side of the enamel, which is the lingual side. And it looks like that. Erosion. Secondary dentin. This is internal resorption. External resorption. We talk about that. Discoloration of teeth. Abnormal staining of teeth. Tooth trauma. Mostly, you don't see the tooth trauma. We see the effect of tooth trauma after tooth extraction. There's somebody classified tooth trauma. If it's just the enamel, is a class 1. If it's enamel and dentin, class 2. If it's enamel, dentin, and pulp, class 3. If it's the alveolus, fracture of the bone, which is a class 4. And sometimes the tooth patient fall and laxation of the tooth will, like, you lose the tooth, and it happens more in baby teeth or newly erupting teeth. It can be extrusive, like extraction, or intensive, like the tooth will cut the bone, will be inside the bone, or lateral, or can be removal, the whole tooth will be removed. There's many theories. What are you gonna do? Put the tooth, some people put it in the milk because isotonic when the tooth be extracted. And sometimes the tooth, the baby tooth will hit the adult tooth that's erupting and can cause delaceration, can cause damage, can cause rotation, all these things. Root fracture. This is another picture of erosion. Sorry, the slide is messed up because the writing different. Have you seen these cases? I've seen it in the book. I'm showing you this people with extra teeth. This is very rare. I never seen this, but I've seen
someone with a double set. So they had like,
yes,
2 on each side. They had like 4, but not like that. Like 4 in the top and 2 on each side.
Extra teeth, yeah. Okay. Marcia, just remove the psycho. I don't. It's not mine. So just DLT. Okay. Psychology.
What did you say?
Oh, I can control just the dental lab technology. I'm not controlling the other courses.
Oh, okay. Okay.
Yeah.
I was filling out that Google document now.
Yeah. Thank you. So yeah. So I have other 2 girls. They should be join us in the fall. So we will have an idea, and we're gonna do the spring and the summer if we stay alive. You know, we're talking about summer next year. Yeah. So let's put that so I can give it to the college, because before I have you guys, because last year and we started, my students are finishing, so the college put the random anyway. So
they put random students in your class?
No, not random courses. Usually, if it's going my way, we'll start dental anatomy, dental anatomy, physiology, and dental material. That's starting effect. Anatomy and physiology. Then we start complete denture, partial complete denture, and we're gonna do advanced complete denture. Then partial denture, advanced partial denture, and then we're gonna do ceramic, as Chandra wants, the ceramic and crown bridge. These are a little more advanced, but because she was with me before, and but I can add advanced. Maybe we can because you guys, you have an idea now about the anatomy and physiology, about denture, restoration. So, and even every lecture, I can give you insight of other topics.
Okay.
Okay, and I put the Moodles and I fill it with lectures and stuff, and anything you want, just let me know. All right. Okay. Anything else?
So you said the last day of class is the end of this month, and when does the
24th is the last day of the 24th.
So next Wednesday?
Next Wednesday is the last day of the courses. So we have just one lecture if you want to do it. If you want to come, if you, Marsha, or if you
I
want to
turned
come.
everything in. Everything's turned in for me. I just need those three. There's 3 Moodle quizzes or tests, surfaces of teeth, that Moodle messes up the grade every single time I take it. It's 3 of them. It's only 3 of them, but everything else is done. I finished everything.
Yeah, if you couldn't fix it on Moodle, send it through email. So like we have documented that you made it, and on the final grade I have it. So don't worry about that.
Okay. All right. I already emailed Mr. Patrick Calhoun and I asked him to put me into those 3 courses. You got dental anatomy. What are we taking? Dental material.